Hello ma'am, my name is Brittany. I'll be your nurse today. These are the doctor's orders and it says you're supposed to have a physical assessment today, okay? I'm just going to wash my hands and I'm going to give us some privacy. Alright, can you tell me your name and your date of birth?
Gray Griffith 8788.
Good. Alright, let me check your wristband. Good. Alright. So overall appearance right now, she's making eye contact with me. She knows her birth date. Do you know what year it is? 2023.
2023.
Good. And then do you know where you are?
At my house.
Yes. So she's alert and oriented ×4 to time, person, place, and situation. She's answering without having me repeat, so it seems like her hearing is pretty good. Her skin color seems appropriate given her age and ethnicity. So now I'm just gonna inspect your head, okay?
Okay.
So I'm feeling for any lumps or lesions.
Okay.
And then it looks like her hygiene is good, her hair is clean, scalp is clean, and head is symmetrical. And then we're just gonna look at your ears. Your ears are midline and symmetrical. Eyes are symmetrical. Her nose is symmetrical. I'm just gonna assess your, have you had any issues or problems with your seeing?
No.
Okay. All right, I want you to look at me and look over my shoulder. Okay, so we're gonna do Perla. Her pupil size, I would say, is about a 4 or 5 millimeter. And we're gonna see, is she reactive? They're equal and round. And we're going to see if they're reactive to light and then accommodation. Okay, so just look over my shoulder. Good. Good. So they both responded to light equally. And then I want you to look at my finger. Look at the ceiling. And look at my finger. One more time. Ceiling and my finger. Good. So they accommodated to, they constricted when they're at my finger and they dilated when she looked at the ceiling. Good. I'm just gonna look in your ear real quick. Okay, so no discharge, no redness or swelling. I'll look in the other ear. No discharge, no redness or swelling, okay? Like I said, her nose is symmetrical. Have you had a runny nose or anything like that?
No.
Okay. We're gonna make sure that both of your nares are patent. So do like this. Okay, and then other side. Good, and then just let me take a look. Okay. So mucosa is pink and there is some moisture there. All right, and then how many times a day do you brush your teeth?
Twice.
Good. Now let me just take a look in your mouth. Open up. Okay. Teeth look pretty good. Like she has good oral hygiene. The uvula was midline. No swelling. Mucosa was pink and moist. Teeth were shiny and the appropriate color. Okay. And then let me just check out your throat. So trachea is midline. Can you swallow? Have you had any trouble swallowing? Okay. And I'm just gonna go ahead and check for JVD. My head of the bed would be 45 degrees. All right, so can you look that way for me? All right, no JVD on this side and this way. Good. No JVD there. So if it were the Glasgow Coma scale we were assessing, she would be a 15. She opens her eyes. She talks without slurring her words, no difficulty talking, and then her motor skills, she responds appropriately. We're going to assess the skin turner on the clavicle. Okay, I'm just going to kind of pinch your skin up. Okay, so elasticity is there, no tenting, and it returned normally in plenty of time. Okay, and now we will do the respiratory, and I'm going to start in the right upper lobe. Okay, so I'm just going to listen to your breath sounds. Have you had any difficulty breathing?
No.
Shortness of breath?
No.
Okay. So I'm going to start in the right upper lobe. Deep breath in and out. Good. And then I'm going to move to the left upper lobe. Deep breath. And then still in the left upper lobe. And then still in the right upper lobe. Those are my 4 interior breath sounds. And then I'm going to listen to the right lower lobe. Deep breath in and out. Okay. And then left lower lobe. Good. And we'll go ahead and do the cardiac sounds. So I'm going to listen to the diaphragm of my stethoscope. In the second intercostal space on the right side is my pulmonic. And I'm just listening. I don't have to breathe. And then still in the second intercostal space is my, no, this was my aortic, and then this is my pulmonic. Third intercostal space is the Erb's point. Fourth intercostal space is the tricuspid. And then in the mid-clavicular line in the fifth intercostal space is going to be my mitral. Also the apical pulse, which I will listen to for 1 minute. We'll do 30 seconds. All right. Good. Now, if you'll just lean forward for me a little bit, I'm going to do your posterior breath sounds.
Okay.
And I'm going to start in the left upper lobe. Deep breath. And then the right upper lobe. Then we're going to go to the right middle lobe. And then the left lower lobe. Good. So no shortness of breath, no coughing or anything like that. So some respiratory exercises. We're going to pretend like we have an incentive spirometer. All right, so what you would do is you would hold this incentive, you would put your mouth on the mouthpiece, and you're going to suck in slowly. That's going to open up the lungs and prevent pneumonia. You would do that 10 breaths every hour while awake, okay? And then also we have the turn, cough, deep breathe. So you would turn your head, you would inhale and cough, and you want to do that every 2 hours, okay? So now we will assess the nail beds and the capillary refill. So let me just look at your hands, okay? So less than 3 seconds, okay? 5, beds look normal. I'm going to assess the radial pulse. She has a radial pulse bilaterally. Good. And now I'm just going to check for any edema. So we're going to start here. No edema in the upper extremities. And while I'm here, I'm going to go ahead and do my range of motion in the wrist. All right, so I want you to flex your elbow and extend. All right, now flex again. Keep going. And then extend. Okay, now. Good. So the range of motion in the elbow joint, she has full range of motion. Flex and extend. All right, flex. Good. Extend. And good strength. Now hold both of your arms out. You're going to flex your wrist. So we're going to flex up, and then we're going to go down. All right, do it again. All the way. Good. And down. Good. So full range of motion and a strength of 5 in her elbows and wrist. Okay. Now let's listen to her bowel sounds. So we're going to pretend like her shirt is lifted and she just has a couple of skin folds, no scarring, no stretch marks or anything like that. And we're going to start in the right upper quadrant. And then the left upper quadrant. And the left lower quadrant. And then the right lower quadrant. So bowel sounds are normal and active. One thing I forgot on the cardiac is if we wanted to listen for any murmurs or abnormal heart sounds, we would listen with the bell of our diaphragm when doing the cardiac sounds as well. And then also listening with the gastric sounds, you can listen for an aortic aneurysm. And have you had any trouble going to the bathroom pooping?
No.
Okay. Back to our skin assessment. There are 3 risk factors according to the Braden scale, and that would be nutrition. She eats well and properly, so no worries with that. Mobility, she is able to ambulate on her own. And then moisture, which she doesn't have any reason why she would have any kind of excess moisture, as she doesn't have any incontinence. So we did our cardiac, our respiratory. Let me just check. I'm gonna just take your shoes off, okay? And I'm gonna palpate the dorsalis pedis and check for edema.
Sorry, that both of my socks are.
And then the tibial. Good. All right, so she has bilateral pulses in the arteries. All right, let's just go ahead and we will do your range of motion in your ankles, okay? So I want you to point down and then flex up. Good, now point down. Good, and flex up. And then other side, point down, flex up, and point down. Good, flex up, nice. All right, let's let's do your knees. So extend this leg, extend, and flex, down, and then extend, and flex, down, and then up this side, extend, and flex. Good. Extend, and flex. All right, no crepitus in the knees, the full range of motion in the ankles and the knees. Did that cause you any pain?
No.
Good. All right, now we're gonna look at your look at the I'm gonna palpate your abdomen just to tell me if you feel any tenderness on that side. Any tenderness? Good. Okay. Now, have you had any falls recently?
No.
Okay. So let's assess your gait. So stand up for me. Stand. We're gonna push this chair back up a little bit. All right. Now I want you to close your eyes for a minute. Good. So that's normal. All right, back up a little bit. Open your eyes. Okay. Now just walk towards me. And walk back. Good. And then on your tippy toes, walk towards me. And then walk back. Good. All right. You can have a seat. So gait is normal. No risk for falls, being that she has good mobility, is ambulatory, and has a good sense of balance. Is there anywhere you're having any pain or anything like that?
No.
Okay. All right, well, I think that concludes our physical assessment. Thank you so much.
Mm-hmm.